How does India, a country of 1.3 billion people, have around 1,000 coronavirus deaths? Less than a month ago, India's future looked dire. Experts predicted that the country could expect millions of coronavirus cases. Doctors warned that India needed to prepare for an onslaught of cases that could cripple the country's ill-equipped health system. Onlookers worried that the virus could spread like wildfire through India's slums, where residents live in cramped quarters and basic sanitation often isn't available. But so far, the world's second most populous country appears to have avoided the worst. As of Tuesday, India had reported 31,360 coronavirus cases and 1,008 deaths, or about 0.76 deaths per million. Compare that to the United States, where the number of deaths per million is more than 175. Some experts say that India's relatively positive numbers suggest the country's nationwide lockdown to halt the spread of COVID-19 could be working, for now. India didn't wait for the problem to escalate, India's Prime Minister Narendra Modi said on April 14, as he extended the country's 21-day nationwide lockdown until May 3. Instead, as soon as the problem appeared, we tried to stop it by making swift decisions. I can't imagine what the situation would have been had such quick decisions not been taken. But the reality behind India's numbers is more complicated, and experts caution that it is too early for India to congratulate itself. At least in this round, it appears that the virus has not been able to damage as much as been feared. Srinath Reddy, the president of the Public Health Foundation of India, a non-profit that works on training, research and policy development. I don't think we can say that we have completely closed the book on this. How swift were Modi's decisions? On March 24, Modi announced that the country was going into a 3-week lockdown. The scale of it was unprecedented. India has a population of 1.3 billion, and the only country with a bigger population, China, had imposed citywide lockdowns, but never a nationwide one. It was a high-stakes decision. Going into lockdown meant millions of daily wage workers would be deprived of an income. But not imposing a lockdown risked overwhelming India's healthcare system. One model estimated that without social distancing measures, about 150 million people in India would be infected by June. On Friday, India's top pandemic official said that the country would have had more than 100,000 cases by now if it weren't for the lockdown. India moved into lockdown relatively quickly, it was announced, when the country had reported 519 coronavirus cases. By comparison, Italy waited until it had more than 9,200 coronavirus cases before it went into a nationwide lockdown, while the United Kingdom had about 6,700. Amanand Laxminarayan, the director of the Center for Disease Dynamics, Economics, and Policy, a non-profit research organization with offices in Washington, D.C., and New Delhi, said the decision to impose a lockdown promptly, even when case numbers was low, had likely reduced contact rates significantly. Following the lockdown, thousands of migrant workers attempted to leave India's major cities after the restrictions left them without jobs. That prompted fears that the migrants could spread the virus, with some officials in the Indian state of Uttar Pradesh even spraying returning workers with disinfectant, an ineffective approach to controlling coronavirus. Around a week after the lockdown began, 2 people had died from coronavirus in Mumbai's densely packed slums. Following the second death, several of the man's family members had been tested and placed under home quarantine, and the block of 300 homes and 90 shops that make up his neighborhood have been sealed off. By the time the lockdown was imposed, India had already taken other measures. On March 11, India suspended all tourist visas and announced that all travelers who had been in the most affected areas of the world in the past few weeks would be quarantined for at least 14 days. From March 22, all international commercial flights were banned from landing in India and all passenger train services in the country were suspended. The United States, by comparison, has restricted foreigners traveling from China, Iran, and certain European countries, but there is no blanket ban on foreigners entering the country. Source: CNN.